Tchouatieu is my name. I'm a medical doctor by training, working MMV as a director for access and product management.
Well, I'm Abena Poku-Awuku. I work in the advocacy team as an advocacy manager. Seasonal malaria chemoprevention is an intervention that was introduced by the World Health Organization in 2012 to provide some level of protection from malaria for children aged 3 months up to 5 years within a certain zone of Africa that experiences seasonal malaria.
The principle of this protection is that during the period of this high transmission, they have a certain level of drugs in their bloodstream, so that even if they are bitten by mosquitoes, the parasite will not be able to develop in their bloodstream. It can protect them for a period that is estimated to about 28 days. So after 28 days, a new dose is given to cover the whole period of transmission.
13 countries are implementing SMC. These include Guinea, Guinea-Bissau, Mali, Togo, Benin, Nigeria, Niger, Senegal,
Chad and
Cameroon.
We have a strategy in, let's say, 3 pillars with short, medium, and long term.
MMV, together with a number of partners, so the London School of Hygiene and Tropical Medicine, University of Thiès in Senegal, and also TDR, we started the Opt-SMC project to support countries and also to learn from each other actually in what the challenges of implementing SMC are and how we together can optimize SMC so that we can get the highest efficacy from SMC. SMC Alliance is basically a group of partners who have come together, who are all working on SMC.
We are foreseeing this as a place where all the discussions can happen between the countries, the funding partners, the implementing partners. Everyone being around the table, we can find solutions for any challenges.
Key highlights for this year is that SMC is 10 years old. This is really exciting for all of us, especially because if you look at the way SMC has progressed over the last 10 years, like it started with about 2 million children, now we've reached 44 million children, and so there's been a lot of progress actually.
When they launched SMC in 2012, there was no drug. This is a child intervention, and there was a need to have a child-friendly formulation, and that was not the case at the beginning. With our partners, manufacturer, we developed a dispersible formulation where the beta test is masked, and this is what is now being used on the field. And definitely there is a need to get more funding. We should also look at how we can implement SMC in routine activities of the health system.
So to ensure that all eligible children receive SMC, we also would really like the countries to come on board, the national governments come on board to really support SMC a lot more and make sure that all the hard-to-reach children are reached.
We'll never get to malaria elimination without that real leadership from our leaders in our country.